Hey, your wait is over. Welcome back to my channel. This video is all about MCQ keys and concepts of dentition and bone age estimation. In previous video, we have MCQs only. In this video, we are going to discuss all concepts, keys associated with those MCQs. Do not skip anything, watch till end. So now let's start learning. I am Dr. Triyavirani Madde, pediatrician and consultant neonatologist, and I'll be your guide for pediatric subject. If you are new to my channel, please do subscribe and give like to this video because it motivates me a lot when I see like in the video. Question number 1 was, primary dentition begins to show teeth eruption by which age? Your options were A, 6 weeks, B, 12 weeks, C, 6 months, or it is D, 12 months. So what was the correct answer? Yes, you are right. The correct answer is option C, 6 months. For remembering this answer, you need to go through this slide and just have a picture in your mind of these slides, and you are all done with the eruption. So if you see the primary dentition, it is also called milk teeth. They are 20 in number. They start at the age of 6 to 7 months and they are all done by the age of 3 years. While if you remember the primary dentition, in case of secondary dentition, they are all known as a permanent teeth or a secondary dentition. They are 28 to 32 in number. They start showing eruption by 6 years. See, here it is 6 to 7 months. Here it is 6 years. And they are all done by the age of 12 years. So our next question is, by what age all milk teeth are erupted? Your options are A, 1.5 years, B, 2.5 years, C, 2 years, or it is D, 3 years. Please do read question carefully. Here it is written milk teeth. We are talking about primary dentition. So you all know the answer. The correct answer is option D, 3 years. Again, it's a revision of the slide. Milk teeth 20 in number, eruption by 6 to 7 months and done by 3 years. Permanent teeth 28 to 32 in numbers, starts at the 6 years, and they are all done by the age of 12 years. Question number 3. Total number of milk teeth in human being are, your options are A, 20, B, 28, C, 30, or it is D, 32. Again I say, please do read the question carefully. It is milk teeth. Okay, so we all know the answers. It is option A, 20. Let's move to next question. Question number 4. Which of the following is the first incisor to erupt in infant? It means we need to define the location of the eruption of the first teeth. Options are A, lower central, B, lower lateral, upper central, and upper lateral. So correct answer is lower central. For this question, I have given 2 hints in the previous video. If you have not gone through that video, I suggest please go through that video because we have discussed many things about dentition. So it is lower central. The first thing you can remember, just imagine any infant around you and they have 2 tiny teeth in the lower jaw. So the first teeth to erupt is a lower central incisors. The other method to remember is LC, UC, UC, LC. We have to remember like this. LC, UC, UC and LC starts at the 6 to 7 month, then keep on adding 1 month, 6 to 7, 8 to 9, 9 to 10, and it is 10 to 12. Then MCM, first molar, canine, and second molar, 12, 18, 28. So this is the way we can remember the order of the eruption of the milk teeth, and there is no P in the milk teeth, so there is no premolar. This is very important fact for you to remember. Please pay attention over here. There is no premolar in case of milk teeth. And LC, UC, UC, LC, 6 to 7, then keep on adding 8 to 9, 9 to 10, 10 to 12, and then MCM, 12, 18, and then 21. Here also you can remember like this. 12, the reverse number of 12 is 21, so 12, 18, 21. Next, let's move to next question. That is question number 5. First teeth to erupt by Your options are A, first molar, B, premolar, C, incisor, or it is D, canine. Here it is first teeth, so they are talking about milk teeth. So in a milk teeth, we all know that what is going to erupt first. Obviously it is in the lower jaw, and again we have to remember LC. So it is the correct answer is option C, incisor. Again we have to remember this LC, UC, UC, LC starting from 6 to 7, 10 to 12, and then MCM 12, 18, 21. Isn't it easy? Yes, it is very easy. Just pay attention here for 2 minutes and you are done with many MCQs when it comes to primary dentition. Only 2 slides you have to remember. First slides of the eruption of age and completion, as well as this order of eruption. Correct? Let's move forward. So question number 6. At what age do first permanent teeth appear? Here it's a catch. It's not primary. In hurry, do not miss this word. It is permanent. Options are A, 5 year, B, 6 years, C, 7 year, or it is D, 8 year. Whereas you see, first we discuss question number 6. So it is in 2 parts. The 6th one is saying the correct answer is 6 years. Again we are going to discuss these slides. We are talking about permanent teeth, right? We are talking about permanent teeth. So they start showing eruption by the age of which year? 6 years. So correct answer is 6 years. Now let's go to question number 6.2. At what age do first molar permanent teeth appear? Here it's also a catch. You have to see first molar and permanent. This is nothing. It's just to make you more confused. But if you are clear with the concept that in a permanent dentition, which teeth appears first, then you will not be having any kind of confusion. You are going to earn marks directly from this question. So let's have, so here is just a permanent tooth. We know that first permanent tooth is molar. So both question is correct. Here they have just given name of the permanent tooth. So your options were A, 4 to 5, B, 6 to 7, C, 7 to 8, D, 9 to 10. Here also the correct option is B, 6 to 7. Okay, and this comes from this simple shortcut to remember the order of eruption in a permanent teeth is Mama is in pain, Papa can make medicine. Mama stands for first molar, I stands for central incisor, another I stands for lateral incisor, one more P stands for first premolar, then second premolar, then canine. Papa, this P is for Papa. Canine for can, make, again second molar. Now we are left with the third molar. So it is very easy for you to remember. Just remember one sentence. Mama is in pain, Papa can make medicine. Correct? First time is for first molar, then central incisor, then lateral incisor, then first premolar, second premolar, canine, second molar, and third molar. Here also, how you can remember the teeth? Sometimes so many medical students are confused with a simple fact that what are the teeth present in the mouth. So here also you can remember I can play more. Incisors, canine, premolar and molars. 21, 23, 2 plus 1, 3 plus 2, 5, 5 plus 3, 8. So 8 into 4, this is just 1/4 part of the jaw. So we have to again multiply it by 4. So it is 32. And if the third molar is absent, which is absent in many percent, it is called wisdom teeth. If it is not erupted, you may have a 28 teeth in total. So our options were 28 to 32. This is the reason why it was 28. Okay. So this is the way you can remember. Here also you have to just add, keep on adding 1, 6, 7, 8, 9, 10, 11, 12, nothing, and third molar by the age of 18 to 25 years. Let's move to next question, that is question number 7. First permanent teeth to appear. Here also we need to know this is first permanent teeth. It is just a revision of the previous slide. You should all be able to answer. Our options were A, molar, B, premolar, C, incisors, or it is D, canine. We all know the answer. It is A, molar. I am not going to repeat because we want to save the time. Question number 8. How many permanent teeth will be present in 8 years old? Now please pay attention over here. If you understand the simple thing over here, remember one table, you can answer all the questions like this: 8 year, 9 year and 10 year. So options are A20, B24, C12 or it is D16. Here we need to say they are just asking about permanent teeth, not a total number of teeth. We don't need to combine milk teeth along with the permanent dentition. They are just asking how many permanent teeth will be present. So let's go to the first, understand the concept. We all remember this table, right? That first molar, mama is in pain, papa can make the medicine. First molar, central incisor and lateral incisor. We know that till 8 we are having these 3. So 6 year 1, 7 year 1 and the 8 year 1. So we are having 3 teeth in one quadrant. So we need to make it 4 times and it will be 12. Isn't it easy? Similarly, you can do it by 9 year, by 10 year, for 11 year and for 12 year. Do not get confused. They have not even asked which teeth will be present. They have just asked the number of the teeth, which is very easy for us to calculate by this formula. So correct answer is option C, 12. Now the question number 9. Question number 9 is, what is the most common location of the supernumerary teeth? Supernumerary teeth, if you remember the concept, is the extra teeth which is present in our jaw. If you have not gone through the first part of the bone age estimation and dentition, I suggest that please go through it. It will be of lots of help to you. Options are between incisors, B between canine, C between molars and D between premolars. Here you need to just remember the fact that the most common location is between the incisors. So what are the facts you should know about supernumerary teeth? They are most commonly seen between incisors. They could be a part of many syndromes like cleft lip, cleft palate, cleidocranial dysplasia, as well as Gardner syndrome. So the question number 10 is, delayed dentition is considered when there is no tooth by age of. Many a times you are asked question practically also when some relatives child is not having teeth eruption by certain age, they are all worried. So now you can answer this question if you know this fact. So your options were A, 9 months, B, 11 months, C, 13 months or it is D, 15 months. If you remember, the correct answer is C, 13 months. Now we'll discuss something about delayed dentition. When we call it delayed dentition, when it is 13 months and it is around mean plus 3 standard deviation. So we have to remember this figure, 13. Okay, the question number 11. Which of the following is true about eruption of teeth? Again, I insist, please read the question carefully. We need to find correct statement out of this 5. So we need to cross all the incorrect statements. So we'll do the each statement turn by turn and then we will come to the conclusion. So our first option is premolar appear first in primary dentition. B, incisors appear first in secondary dentition. C, third molar is last to develop. D, hypothyroidism delays the dentition. And E, canine is last to appear in primary dentition. Now let's have a, okay, our first option was premolar appear first in a primary dentition. We all know that first teeth to appear is a lower central incisor by two-way LC, UC, UCLC, as well as, remember the infant around you, 2 tiny teeth in their lower jaw. So this statement is incorrect. Move to the next statement. Incisors appear first in secondary dentition. We all know that secondary dentition, our shortcut is mama is in pain, so it starts with all first molar. So this statement is also incorrect. C, third molar is last to develop. Now if you remember this table, mama is in pain, papa can make the medicine. Here the M is for third molar. So this statement is correct. Now let's have a next statement. Hypothyroidism delays the dentition. So if you remember the causes of delayed dentition, these are the few causes. Important one is ricket, hypothyroidism as well as Down syndromes. So these three causes you need to remember, that hypothyroidism, rickets and Down syndrome delays the dentition. So this statement is also correct. So in the last statement is canine is last to appear in primary dentition. If you remember primary dentition, we are having MCM. M stands for second molar. So canine is not last to develop. Last to develop in primary dentition is second molar, second molar. So this statement is also incorrect. So correct answer was C, third molar is last to develop, as well as D, hypothyroidism delays the dentition. Now false about dentition. Again pay attention. False means we have to find incorrect statement. So we have to exclude all the correct statement. So what are the correct statement? We'll just see. Your options are A, hypothyroidism delayed the dentition. B, premolar is not seen in primary dentition. C, third molar is last to develop in secondary dentition, and canine is first to appear in primary dentition. As I guess and I hope that you should know the answer, because this all facts just now we have discussed. So let's discuss it and exclude it fast. We need to find wrong statement, right? So first, hypothyroidism delays the dentition, that is correct statement, just now we have discussed. Premolar is not seen in primary dentition. I have taught you that in milk there is no P, so no premolar in primary dentition. This statement is also truly correct. Now let's move to the third one. Third molar is last to develop. Mama is in pain, papa can make the medicine. This M is for the medicine, and this statement is also correct. And the canine is first to appear. See, this thing has came in a different way. It's like a ball. It comes in a different way from the different direction, but we are going to have a same answer to this question, that the first teeth to appear in a primary dentition is lower central incisors, LC, UC, UCLC, 6 to 7, 8 to 9, 9 to 12 and 10 to 12, and MCM. This is wrong. So our correct answer is option D, canine is first to appear. This is incorrect statement. Now question number 13. Now we are going to have estimation of age from X-ray. So our first question of that is the first epiphyseal centers. Don't get confused about epiphyseal centers and ossification centers. I have made it very simple in my previous lecture. Please go through it so you will be understanding all the bone facts of childhood. So epiphyseal center, or in the very simple language, which bone is first to grow? Your options are A, femur, B, cuboid, C, clavicle, or it is D, ossicle. Now let's have a fact about it. Femur is the first bone to appear. It starts appearing by the age of 5 to 6 weeks, and it keeps on ossification, keeps on doing ossification by the 21 to 25 years. So this is the bone which has the longest period for, because it bears the weight of the body. So first bone to appear is a, which bone it is? It's a femur. The option A was the correct. It's a femur. Okay. Question number 14. What is the most probable age of this newborn? The options were A, 34, B, 36, C, 38 and 40. It is very easy for you to remember and understand. Do not skip this question. Please pay attention here for only 2 minutes. We are going to remember two things only out of it. So, first of all, in the knee of the newborn, the lower femoral epiphysis will present at 36 week and upper tibial epiphysis will be present at 38 weeks. The lower femoral epiphysis is 36 and the upper tibial is 38. Do not get confused, 36 and 38. So if this is only present and this is not present, age is 36. And if this both is present, our age is 38. But if this both is not absent, it means it is less than 36 weeks. So correct answer is option A, 34. If both is present, we are dealing with the newborn who is more than 38. If this one is present, lower femoral means lower femoral present, upper tibial is not there, it means it is 36, but both of them are absent. Both of them are not there. Then it is less than 36 week. Among the given option A is correct. Now few fact, these two are present at the time of birth. Femur distal and the tibial proximal, we all know, just we have seen the X-ray. Humerus head by 3 weeks, femur head by 4 months plus or minus 2 months, and patella by the age of 2 to 4 years. Now question number 15. Which of the following X-ray should be advised for the age estimation between 1 to 13 years? The question is asked in a way that we are having a child who need to have an age estimation from X-ray between the age of 1 to 13. So which X-ray we should order? Your options are A, shoulder, B, wrist, C, elbow, or D, iliac bone. Now let's have a discussion on this. We need to remember only two facts. If we are having a child who is between 1 to 13 years, we are going to order the X-ray of wrist, correct? And if we are having a child who is between 12 to 14 years, we are going to order the X-ray of elbow and hip. Here it is clearly asked that less than 13 years, we are going to ask for the X-ray of wrist. At the end of 1 year, number of carpal bones are present in the skiagram of the hand is, options are nail, B, 1, C2, or it is D3. Again attention, pay attention here for 2 minutes and you are done with the bone edge. So here we need to remember that whatever number of carpal bones are there, we have to minus 1, and that will be the age of the child. So age var appearance is like this. At 1 year we are having 2, 2 year 3, 3 year 4, 4 year 5, and 5 year 6, and 6 year 7, like this. So this is the way we are going to remember. So correct answer here was C option number 2. Next, let's move to the next question. You ordered a wrist X-ray for 2 months old. How old it is? 2 months. Which carpal bone are you expecting it to be present? Your options are A, capitate, B, scaphoid, C, lunate, or it is D, trapezoid. Now for this also I have given a simple thing, that by the age of 1 year we have a cap and hat. Cap and hat are synonyms. So we are having a capitate and hamate by the age of 1 year. But C always comes first. If you take alphabetical order A to Z, C comes first, so cap should come first before the hat. So by the age of 1 to 2 we are having cap, and 2 to 4 we are having hat, because cap is smaller. So this baby is small, can wear the cap. So 1 to 2 months we are having capitate, 2 to 4 months we are having hamate. So by the age of 1 year we are having 2 carpal bones. One is capite, another is hamate. Capitate is by the age of 1 to 2 months, and hamate is by the age of 2 to 4 months. Rest we all know that for age we need to minus 1 from the whatever bone is present. We have to minus 1 to come to the age of the child. So now it is very easy, I guess, that what is the most probable age of this child. Your options are A, 6 months, B, 1 year, C, 3 year, or it is D, 7 year. So the options are there are four carpal bones. One is here. I don't think so whether you can see. 2, 3 and 4. Even if you cannot make out 3, see the options. We are having 3 bones. 6 months we are having 2. By 1 year we are having 2. By 7 year we are having 6. So even if this tiny bone you cannot make out, this option is correct option, because rest all we are going to have either lesser number or more number. So option C is your correct answer. So that conclude MCQ keys of bone age estimation as well as dentition. I hope you learnt well, understood well. I would like to know your suggestion for the improvement of my lectures, and please let me know what else you would like to learn from me. I would be very much happy to be your guide for that specific pediatric topic. If you are new to my channel yet not subscribed, please do subscribe, because lot is going to happen on this channel, and give like to this video because it really motivates me. Upcoming series is on upper segment and lower segment ratio. We are going to have a base on short stature. So for solving a short stature, we need to have upper segment and lower segment ratio. As a part of anthropometry, we are going to do that thing in upcoming series.